Respiratory system, breathing easy, a comprehensive look at the anatomy and physiology of the respiratory system. Hello, welcome to the Science Guide ASAP Learning. Today we are going to be speaking about the anatomy and physiology of the respiratory system. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Be sure to watch the other videos in this anatomy and physiology playlist. The respiratory system is responsible for the exchange of gases between the body and the external environment. It consists of several organs, including the nose, pharynx, larynx, trachea, bronchi, bronchioles, and lungs. The process of breathing begins with the inhalation of air through the nose or mouth. The air passes through the pharynx and the larynx, which contain the vocal cords. From there, the air travels down the trachea, which divides into two bronchi, one for each lung. The bronchi divide further into smaller bronchioles, which eventually lead to tiny air sacs called alveoli. The alveoli are the site of gas exchange. Oxygen from the air enters the bloodstream through the walls of the alveoli, while carbon dioxide from the bloodstream diffuses into the alveoli to be exhaled. The respiratory system is controlled by the respiratory center in the brainstem. This center regulates the rate and depth of breathing in response to changes in the body's oxygen and carbon dioxide levels. Several factors can affect respiratory function. For example, smoking can damage the lungs and increase the risk of respiratory infections and lung cancer. Environmental factors such as pollution and allergens can also have negative effects on respiratory health. Certain medical conditions such as asthma, chronic obstructive pulmonary disease, COPD, and pneumonia can impair respiratory function and lead to difficulty breathing. Treatment for respiratory conditions often involves medications such as bronchodilators and steroids, as well as lifestyle changes such as quitting smoking and avoiding triggers such as allergens or pollution. In severe cases, oxygen therapy or mechanical ventilation may be necessary to assist with breathing. In summary, the respiratory system is responsible for the exchange of gases between the body and the external environment. It consists of several organs, including the nose, pharynx, larynx, trachea, bronchi, bronchioles, and lungs. The process of breathing is controlled by the respiratory center in the brainstem, and several factors can affect respiratory function. Treatment for respiratory conditions typically involves a combination of medication and lifestyle changes. The respiratory system is also involved in regulating the body's acid-base balance. The body must maintain a certain level of acidity, or pH, in order to function properly. When carbon dioxide levels in the body increase, such as during exercise or in response to stress, the respiratory system responds by increasing breathing rate to eliminate excess carbon dioxide and maintain pH balance. The respiratory system also plays a role in immune function. The nose and upper respiratory tract are lined with tiny hairs and mucus that help to trap and remove harmful particles such as bacteria and viruses. Additionally, the lungs contain specialized immune cells that help to defend against respiratory infections. Another important aspect of respiratory physiology is the concept of lung volumes and capacities. Lung volumes refer to the amount of air that can be moved in and out of the lungs with each breath, while lung capacities refer to the total amount of air that the lungs can hold. These measurements are important for diagnosing and monitoring respiratory conditions such as COPD and asthma. It's worth noting that the respiratory system can also be affected by certain medications and medical conditions. For example, opioid pain medications can depress respiratory function, while conditions such as sleep apnea and obesity hypoventilation syndrome can lead to breathing difficulties during sleep. In summary, the respiratory system is involved in gas exchange, acid-base regulation, immune function, and lung volumes and capacities. It can be affected by environmental factors, lifestyle choices, medications, and medical conditions. Understanding the anatomy and physiology of the respiratory system is crucial for maintaining respiratory health and diagnosing and treating respiratory conditions. The respiratory system is intricately connected to the cardiovascular system. The lungs receive deoxygenated blood from the right side of the heart and return oxygenated blood to the left side of the heart to be pumped to the rest of the body. This process is called pulmonary circulation. In addition to gas exchange, the respiratory system also plays a role in regulating blood pressure. When carbon dioxide levels in the body increase, the blood vessels in the lungs dilate, allowing more blood to flow through and lowering blood pressure. The respiratory system is also affected by the aging process. As we age, our lung tissue becomes less elastic and our airways may narrow, making it more difficult to breathe. This can lead to conditions such as chronic bronchitis and emphysema. To maintain respiratory health, it's important to engage in regular exercise, maintain a healthy weight, and avoid exposure to environmental toxins such as cigarette smoke and air pollution. Eating a healthy diet rich in fruits, vegetables, and whole grains can also support respiratory function by providing essential nutrients such as vitamin C, vitamin E, and magnesium. In cases where respiratory function is impaired, treatments such as oxygen therapy, bronchodilators, and pulmonary rehabilitation can help to improve breathing and quality of life. Overall, the anatomy and physiology of the respiratory system is complex and multifaceted. From gas exchange and acid-base balance to immune function and blood pressure regulation, the respiratory system plays a vital role in maintaining overall health and well-being. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Be sure to watch the other videos in this anatomy and physiology playlist.